Hello, do you have type 2 diabetes? Does anyone in your family have type 2 diabetes? Then I strongly recommend that you watch this two-part presentation because it is all the information that you absolutely should know about your condition or your family member's condition. Before we go into the topic of diabetes itself, let's talk about glucose. We all know that diabetes is a result of high blood sugar causing damage to the body. So glucose is the main source of energy for the human body, and we need glucose for proper functioning of all the organs inside the human body. The food we eat is basically converted into glucose within our digestive system by various enzymes, and the blood then carries this glucose into the organs. Now we need a hormone called insulin to help transfer this glucose from blood into the cells. Insulin is produced by pancreas, which is an organ that is located in the abdomen. Let's now talk about the risk factors for type 2 diabetes. There is a common theme. More about this in a minute. Unhealthy eating habits, lifestyle being sedentary, both at work and home, lack of exercise activity, excess weight or obesity, smoking, excessive alcohol consumption, stress, and other factors such as family history, the genetic makeup of Indians, which puts them at higher risk for getting diabetes, especially in combination with the above mentioned factors. Certain medicines also can contribute or increase the risk for getting diabetes. And if a woman has had diabetes in any of her pregnancies, that increases her chances of getting type 2 diabetes later on in life. And polycystic ovary syndrome in women also puts them at higher risk. So coming back to the common theme, as you can see, the first few risk factors that I've described or detailed on your screen are quite similar to the risk factors for high BP, for stroke, for heart disease. So the pattern is actually very obvious. We lead an unhealthy lifestyle, don't exercise enough, eat the wrong kinds of foods, and smoke or drink alcohol excessively. These and have a tremendous amount of stress in our daily lives. These modifiable risk factors tend to increase our chances of getting diabetes or high BP or high cholesterol problems or heart disease or stroke tremendously. So by modifying our lifestyle, making sure that we get that exercise going, eating right, eating healthy, eating home cooked food, smokers quitting smoking, and curtailing alcohol consumption considerably or not drinking alcohol at all will go a long way in preventing these conditions from even setting up shop in our bodies. What exactly happens? We talk about type 2 diabetes as a health condition that is quite serious, but what exactly happens in this in type 2 diabetes? By the way, type 2 diabetes is the most common form of diabetes in adults, the other form being type 1, which we do not see as much in the adult population. Now, type 2 diabetes develops if the blood insulin level is low. Remember that insulin is the hormone that is produced by pancreas, which is an organ in the located in the abdomen, and insulin helps transfer blood glucose into the cells. So the second reason why this condition could develop is if the insulin that is being produced by pancreas is not working well enough. This is what happens in obesity when there is excess abdominal fat that we call visceral fat. This increases the resistance the body has towards the functioning of insulin. In other words, insulin is being produced by pancreas, but it is not having any effect on these cells in transferring glucose from blood into these cells. So glucose starts building up in blood instead of providing energy to the tissues and organs. Remember that the glucose can only provide this energy if it's effectively transferred or transported from the bloodstream into the cells. So the high circulating blood sugar will slowly start causing damage to various organs, tissues, blood vessels, nerves, and this is what leads to all the complications that we hear about and see from diabetes. The one very good news is that there is an extremely simple test for diagnosing this very important and serious condition. So if you are at risk for getting type 2 diabetes because of the various risk factors that you may have, how do you find out? Like I mentioned, that one simple test is called a fasting blood sugar test. If the level is less than 100, we consider the test to be normal. If the level is between 100 to 125, that means that you have the tendency for developing diabetes. Let's call it pre-diabetes. If the level is greater than 126 milligrams per deciliter, that means you have diabetes. So please note down these numbers, remember them. It's extremely important that you know what's normal and what's not. Let's briefly talk about the management of pre-diabetes. Keep in mind, if your fasting blood sugar is between 100 to 126 milligrams per deciliter, that means you have pre-diabetes. If you are overweight, try and lose weight. Remember that losing even 10% of your current body weight is going to make a big difference in improving your overall health. Implement changes in your dietary pattern. Try and eat home cooked food as much as possible. I've mentioned this many times in my previous presentations that the best food that you probably can eat is home cooked food. And make sure that you exercise every day, be active, move around more, climb stairs, walk in the house, don't sit in front of the TV for too long. At work, if your job is sedentary, get up every 15-20 minutes, walk around, take a 5-minute walking break, move around. If you're a smoker, quit smoking. If you don't smoke, well, congratulations for not smoking. Do a follow-up blood test, again, a fasting blood sugar test in a few months to see if there is any improvement. And when you go see your physician, ask questions. Find out what changes you have to make to your lifestyle and what kind of help you can get in making those changes. And also find out if there is any need for medicines at this point in time for managing this pre-diabetes health condition. Control risk factors as much as possible. And I have gone into great detail in explaining the changes that you need to make for improving your this particular health condition in pre-diabetes topic, and go ahead and see that. If you've already seen it before, review it one more time. Alright, we've talked about the one test for diagnosing type 2 diabetes, which is a fasting blood sugar test, but there are other ways to find out also. The other ways are getting a random blood sugar. Let's say you've just done a blood sugar test. Maybe your friend has a glucometer, or you've gone to the lab, not fasting, just to see how much your blood sugar was, and you got the test and the report came back saying that the blood glucose level is more than 200. That is also indicative of diabetes. Hemoglobin A1C is another blood test that can be done for diagnosing diabetes, and if the level is more than 6.5%, that is indicative of diabetes. We'll come back to this test in a few minutes. So you may want to repeat the test on a different day for confirmation. On the other hand, you could get one of the other tests done to confirm the diagnosis. Always consult your physician first and make sure that you get the right kind of help and support. So coming back to hemoglobin A1C, what exactly is this test? This test is also called simply as A1C or glycated hemoglobin. It is a non-fasting blood test. Tells you and your physician about your diabetes control in the previous 3 months. Or if you do not have the diagnosis yet, if the level came back more than 6.5%, that would indicate the presence of diabetes, as I mentioned in the previous slide. So think of it as an average of all of your blood sugar levels 24/7 in the previous 3 months. It is reported as a percentage value, and fasting, as I mentioned, is not necessary for the test. It is one of the best ways to measure your overall blood sugar control. Lastly, I'd like to end this presentation by saying, come on, get the test done. Everyone should get their fasting blood sugar checked in a lab at least once a year. And here I'm talking about all the viewers who have not had this test done within the last few years. If you have pre-diabetes based upon your blood sugar level, get the test done more often. Make sure that all of your family members, all the adults in your family, get tested also for diabetes with a fasting blood sugar test. And you can prevent diabetes by just following a few simple steps. Eating right, staying active, exercising for 30 to 45 minutes every day, losing weight if you are overweight, avoiding eating out often, and reducing your stress level. Thanks for watching.